On November 17, 2006, the FDA lifted the 15-year ban on silicone breast implants. Board-certified plastic surgeon Dr. Joseph Cruz of Cruz Plastic Surgery in Newport Beach explains the improvements made to make them even safer.
My practice is dedicated to cosmetic plastic surgery. So I do really all aspects of plastic, the cosmetic end of plastic surgery, facelift, neck lifts, and of course body and breast as well. Silicone, as you know, just recently came back on the market, and it's been off the market for 14 years. The FDA did what they do best. They took it off the market and they started research studies that have been ongoing for the last 14 years to see if it really does cause these connective tissue disease problems. The findings have all been no increased incidence of any disease process. So they put it back on the market as of recently, and it's been on the market in Europe all the while, and there hasn't been complaints there as well. The difference between a saline implant and a silicone implant, the silicone implant will feel better, and it feels better in the body as well. So, and patients recognize that. There's a lot of good things about saline implants, so I haven't ruled that out as what I offer my patients. Silicone actually is a little heavier than water, and this is a consideration if you're thinking of a big implant and a breast lift, because your breasts have already shown that they're sagging. So if you put a large silicone implant into a breast that's already showed that it will sag, it could sag even more. So the extra weight of a silicone implant may be a consideration. The difference is when you put a saline implant in, it goes in uninflated. So you can imagine that it could go in through a smaller incision. But when you put a silicone implant in, it is already inflated. So it takes a longer incision to do that. The biggest problem with breast augmentation surgery is making sure we get the right size. Actually, if you were to look at the number one reason why a woman will get a reoperation after breast augmentation is because, for whatever reason, too big or too small, she didn't like the size. The way that we've gotten around that is we do something that we specially designed, it's bra sizing. So during the interview, will make sure that the size is a safe size. But then the woman who I'm interviewing for the breast augmentation, she'll go through with the consultant and do bra sizing. So she'll actually try the bra on, look at herself in a mirror and say, wow, this is what I want. Or, no, I want to be a little bigger. And then she's able to get that result. Breast implants in general are not considered lifelong devices. Anyone considering breast augmentation, she should plan on having them exchanged or maybe go for various reasons, but she should plan on having them exchanged at least once in her lifetime. Well, it's all about body proportion, and breast augmentation does wonders in order to improve the breast size. But if you want to improve the look almost exponentially, then you have the midsection that has to be addressed as well. So the most spectacularly happy patient are those that get the breast augmentation and either have a tummy tuck or liposuction, but usually a tummy tuck. And these are women that have had children, their breasts have been deflated, they're not exactly where they want to be, they're a little frustrated because they've been changed by pregnancy, and they come in and have the breast augmentation for the upper part, and then they get their tummy tuck, and their body proportion is back to where they want it.